All right, terrific. So hopefully everybody can see my slide deck. You should see a little map of a digital Australia, and I'll, if that's the case, it looks like it is, I'll get into the digital health service delivery. All good? Yep, excellent. So digital health is kind of a bigger concept than video in of itself. So what I'll do is I'll talk through some things to have in mind with the video side of things, or the telehealth as it sometimes is referred, online consultations, teleconsult. There's quite a bit of language and jargon in healthcare depending on what type of practitioner you are and who the software vendor is. But I'm also going to give you some background and overview on things to think about beyond today as well. Bigger opportunities that will exist once you've actually implemented the video side of things and you're able to actually adjust or adapt to the current circumstances to be able to provide some online healthcare services to your clients. And but at least you'll have a little bit of a roadmap where you'll know that you're starting at a point today, but there's some other waypoints to move in the destination. So this is not just going to be a COVID-19 thing. This will be something that will actually reimagine the way you deliver healthcare going forward. And if it wasn't COVID-19, it would be a really exciting time to actually think about the possibility of online healthcare. And so we'll take you through that in a moment. Let's see. So as I mentioned earlier, I founded coreplus a little 11 or 12 years ago now, and focused very specifically on Australian healthcare providers and looking at the digital health vision from day dot. And so that's been something that I've been very passionate about, on how we could actually bring digital health into modern healthcare and really modernize the way that healthcare is delivered. So the term gets used frequently. It's not always understood. Sometimes I joke that it's not just about finger health. It's actually about the ability to empower you and your clients towards better healthcare outcomes, but doing it in a way where all the systems and all the stakeholders involved in those healthcare outcomes are actually connected. And you're doing it in a clinically safe, in a secure and private and seamless way, end to end. So your whole workflow in how you actually operate the business model of healthcare is encapsulated within the digital health idea. And it asks a question. And this is kind of your guiding light when you're thinking about it. And I really liked what Megan was saying earlier about thinking through the lens of your customer and your clients. You know, what is it that they're feeling right now? What are they needing from you right now to continue to support their healthcare outcomes? And so this question is really pertinent. How does your healthcare service fit into the lives, the schedules, the goals, and the aspirations of your clients? And that will be a moving target. Right now, self-distancing and staying at home, not going out as often, is part of your client's life, just as it is to a greater extent and lesser extent with ourselves. So asking this question and getting that kind of feedback will really help sort of nail down what is the most important thing tactically to do to be able to respond to that. Having that in mind and getting that sense of what it is that we need to do right now, the whole idea of digital health is to get us to think through how we map a service that is an experience for the client. It actually becomes an end-to-end journey for them, whether they're an existing client or a new client, how they're actually introduced to you. I use the term the digital healthcare experience. It's something that I've coined in recent years as I've started talking more and more about this idea. It's how we design a service experience using digital health concepts. And it's really a useful conceptual framework and a useful idea on how to approach the reimagining of healthcare using digital health systems, tools, with ultimately the idea that you're becoming much more client-centric as you go forward. And there's a reciprocal value to you, because the more that you help your clients achieve their goals, and the more you fit into their lives, and the more that you offer value and support them with their healthcare outcomes, the more they value you. And that means that they're prepared to pay a price. They're prepared to meet you on the terms that you need to be met. And your relationship becomes very strong over a longer period of time. So the three essential ingredients for this are to have a mindset, which is about thinking through the complete sum of the experiences that your client is going through when they're interacting with your healthcare service. And this is a very flexible idea because it's something that you can break down at different stages. You don't have to think about this as being a really big project. But when you're doing telehealth, for example, and I've got some slides a little bit further down, you can empathize with what that experience is likely to be like for your client, and then put some thought into the way that that service is going to be delivered to ensure that that experience is optimized for them as well. And the second ingredient category is technology. So obviously getting the right tools that are compliant and support you in workflow, compliant with the rules and regulations of the jurisdiction that your client is in. So in this case, primarily Australia. I'll talk about some aspects of outside of Australia services a little bit further down. And using that, thinking about this as an opportunity to extend your healthcare services beyond your postcode, where your clinic resides, for example, at the moment, or perhaps the different locations that you've been used to servicing. So in a way, the difficulty of perhaps cancellations and bookings declining in the face of COVID-19 kind of forced the idea that perhaps now with telehealth, you're no longer constrained to those physical locations. You can now actually market your services Australia-wide. So that actually opens you up for a much bigger potential client opportunity. And the sooner you do that, you'll have the lead, I guess, in this kind of evolution of change that's happening at the moment. The third broad category is, in broad terms, systems and culture. And I use the term systems because I think of systems as separate to just technology. Just having a tool in place and none of your team or none of your people actually using it is useless. It's not going to give you all the value and the productivity that you need. So the system is what happens when the people and the tech work together. And there's a cultural change that comes with that. And so what I would be recommending is to do that in an agile way, which means, don't try and do too much at once. Just take one step at a time, complete that, implement that, make sure the team's coming along for the ride, then put the next step in place, implement that, complete that, make sure everybody's along for the ride, and so on and so forth. And so you can iterate little by little, and that becomes less difficult for you to actually get momentum in making these changes. When you try and do too many things at once and you end up with these really big lists of things to do, it's very overwhelming. And sometimes you lose sight of what is the most important thing to do next. So iterating is agile. One step at a time is agile. And it's really important to get that feedback from the different steps that you're taking as you're rolling these things out for your clients and for your practice.